All right, I am looking forward to talking to our guest today. He's been on multiple times. He has become a friend. He's also a mentor. I've been reading and studying his work for many years. He's the first guy who taught me about energy medicine, metabolic medicine. Dr. Stephen Sinatra is hip to all kinds of facets of medicine, alternative and conventional. He's got multiple books about the heart, about grounding and earthing, something we've talked about on the program, cardiovascular disease, his books, The Sinatra Solution, Reverse Heart Disease Now, nutritional and integrative strategies in cardiovascular medicine, earthing, The Sinatra Solution. Please welcome to the bright side, Dr. Stephen Sinatra. Hey, Dr. Sinatra. Dr. Sinatra.
Mine.
Hey, buddy.
Good to talk to you.
Good to talk to you again, and thank you so much for coming on. So before I get into some of the stuff that I want to talk about, some of this alternative stuff, I think the missing link in how we're taking care of this viral infection involves the circulatory system in the heart. What do you think?
Oh, absolutely. I mean, one thing about this virus, it locks into the ACE receptors in the lung, but there's lots of ACE receptors in the heart, as well as the GI tract, as well as the brain, and that's why this virus is so fearful, because basically, once you lock into an ACE receptor, the virus has a direct communication with the cellular tissues of the body, and that's why it's so troublesome.
Do you think by using some of the techniques and strategies you talk about, nutritional strategies specifically for cardiology, we can protect ourselves or mitigate issues, long-term issues, if we do get infected?
Oh, absolutely, yeah. I mean, in any patient who suffers myocarditis, for example, and the problem with, the virus is, as well as a vaccine, the virus, I mean, myocarditis is an issue, and it affects predominantly males, more than females, ages 18 to like 45. And I got to tell you, there was an article in Circulation. I read it back in November. It's only about 3 months ago, and it was really frightful because, this is a real situation. I mean, look at all the sudden deaths that have occurred in athletes in Western Europe and even this country for that matter. So as a heart specialist, I'm really concerned about, the invasiveness of this virus into what myocardial tissues.
How about the vaccine?
Well, a vaccine, that's sort of a double-edged sword in a way,
Do you think there's cardiovascular? Is there a cardiovascular impact?
Well, yeah, I mean, yeah, it absolutely can. I mean, the vaccine can, be incriminated in some of the myocarditis cases as well. The virus can do it, as well as some cases of the vaccine has shown up as myocarditis.
How would you, if somebody came to you, they said they had to get vaccinated for their job, or they want it, or they did for whatever reason, what would you advise them to protect their heart from some untoward circulatory effect in terms of supplementation?
Well, I would certainly give him Coenzyme Q10. I'll tell you why. Because one of the reasons why the virus is so invasive, it causes enormous endothelial cell dysfunction. And
those
the hallmark of
tell the listeners what the endothelial cells are.
Basically, the lining of blood vessels, the single lining of the blood vessel that's most vulnerable to aging, sugar, oxidative stress, chemicals, insecticides, pesticides, mercury. It doesn't matter. It's that one layer, endothelial cell. What we call the endothelial cell layer. It's very, very susceptible to what we call oxidative stress, and basically the virus disrupts that, enormously. And the beauty of CoQ10 is that CoQ10 supports endothelial cell function as opposed to the virus that completely disrupts it. So I think somebody will do some research on this in the future. I think CoQ10 is going to be one of these unsung heroes when it comes to viral infection, and especially myocarditis of the heart.
As you're talking about endothelial cell dysfunction, the cells that line line the inside of the vessels, the endothelial cells, I wonder if there's a relationship between endothelial cell dysfunction and inflammation or apoptosis and cholesterol.
Yeah, I mean, all those things are related. I mean, there's no doubt about it. Cholesterol is sort of interesting. I mean, you're a pharmacist. You know this stuff. But remember MRSA staph in children?
Oh, yeah.
I mean, these were children dying of, these
MRSA.
Horrific bacterial infection that there was no antibiotic treatment for. Well, guess what? The children with the highest cholesterol were surviving MRSA staff.
Yeah.
Now think about that.
That's right.
So there's something about, cholesterol. Now, I was involved in the Framingham, data in New England. I don't know if you're privy to that information.
Yeah, I remember it from a long time ago. Remind us what that's where they linked cholesterol to heart disease.
Yeah, right. I grew up in New England. I was a heart specialist in New England. I was part of the Framingham study. I had patients involved, and it lasted for decades, like over 50 years. And the premise was the higher your cholesterol, the shorter you were going to live, the more stroke and heart attack you were going to get. And I'll tell you, Ben, I saw doctors becoming psychotic because it was the reverse. It's like the world is now upside down in a way.
Yeah.
Well, this research was upside down. In other words, the people living in Framingham, the oldest living people had the highest cholesterols.
Unbelievable.
And it drove physicians crazy. It drove these scientists absolutely. It can't be, but that was the truth. So there's something special about cholesterol. And if you look at it, one of the reasons when I researched the great cholesterol myth, it does so many good things to the body.
God. It's probably the most important molecule. I'd go on a limb and say it's the most important molecule in the body, certainly the most multifunctional. In terms of stress management, especially, and helping the body deal with stress.
Without cholesterol, your brain won't work.
Your hormones won't work. Nothing works. No cells.
The hormones won't work. You're right. The bile acids won't work.
You won't get
vitamin D.
Vitamin D.
You won't get vitamin D if your cholesterol is too low. So why kill it?
Listen, Dr. Sinatra, this is how nature works. It made cholesterol a master molecule. It is wouldn't you agree? It's a master molecule in the body.
Yeah, it is. It is.
So, especially for stress management and growing and recovery and anabolism and all the good stuff. If you wanted to suppress the health of a culture uniformly, you could do no worse. A good idea would be to shut down cholesterol production at the level of the cells.
Exactly. We need it for the brain. Must have. Look at the statin situation.
Doc, we got to take a break. We're going to come back.
Go ahead.
We're going to come back. Dr. Sinatra's with us. You're listening to The Bright Side. We'll be back right after this. Okay, we are back on The Bright Side. I'm Pharmacist Ben. We're talking to Dr. Stephen Sinatra. Dr. Sinatra, before I went to break, you were mentioning cholesterol in the brain, if you don't mind continuing.
Oh, yeah. The point I wanted to make was, vitamin D3 is actually made when the sun hits the skin. The skin is loaded with cholesterol. When the UV light hits the skin, we form vitamin D3, and vitamin D3 is absolutely crucial. So, especially in a pandemic, let's face it, that recent study that came out of Israel about a week ago, 2 weeks ago, which showed that vitamin D levels, in the 40 range, so to speak, UGs per ml, the blood level, there was like 14 times less incidence of complications from COVID-19, including death. That's huge. Yeah. So, anybody living north of Atlanta should be taking at least 3,000 to 4,000 units of vitamin D3 a day. It just makes sense.
Do you have a take on sunshine vitamin D versus supplemental vitamin D?
Both. I like both. Getting 15 to 20, 25 minutes of sunlight unprotected is not going to hurt you. Remember, CoQ10 and melatonin are the top two antioxidants that protect you from UV light. But if you're in UV light for longer than 25 minutes, then you can get some damage.
So I didn't know that about CoQ10.
Yeah, CoQ10 and melatonin, the two best nutrients.
More than vitamin E.
Yeah, always, definitely, in the protection against UV light. Vitamin E is more protection against, like auto-emission pollution. I think vitamin E has an advantage there. Those poor toll collectors that are collecting toll. Well, now, a lot
or working in garages.
Yeah. Well, the toll collectors are sort of, vanishing.
Oh my God.
But we still have a few of them here in Florida, and I really feel sorry for them because, they need vitamin E, to protect against auto exhaust.
What do you think do you have a take on the distinction between ubiquinone and ubiquinol? And
absolutely. Listen. I've done so much research on this, and there's a lot of bad CoQ10s out there. I've done more blood levels than anybody else on the planet with CoQ10. I can tell you that. I was doing blood levels for 20 years. If you have a high-quality Ubiquinone, a really good bioavailable Ubiquinone, that's as good as any Ubiquinol. Ubiquinols are great. I haven't found one bad Ubiquinol. They're a little more expensive, but if you have a high-quality Ubiquinone, it's as good as Ubiquinol, and any Ubiquinol is good as far as I'm concerned.
So do you have a take on high doses, 300, 400 milligrams a day versus the standard 50 or 100 milligrams a day?
Most people need 100 milligrams a day, and I've increased that to a couple of hundred milligrams if you're over the age of 60, for example. But when it comes to heart failure or any severely compromised cardiovascular situations, I give higher doses of CoQ10. Remember, CoQ10 with ribose and magnesium and a little bit of L-carnitine forms the awesome foursome, which generates ATP in the preferential direction, or generates the energy, the chi of our heart, of our heart cells. So basically, I really like those four nutrients.
Okay, so ribose, carnitine, CoQ10, and was it magnesium was the fourth?
Magnesium, absolutely.
Magnesium is the fourth. And then let's talk chi, okay? I love that you're hip to that. That's very impressive for a cardiologist, but you're no ordinary cardiologist, of course. So tell us a little bit about how chi fits into the picture with heart disease.
Well, chi is your energy, and see, as a heart specialist, one of the most significant symptoms of heart disease is low energy. People will say to me, Doc, I can't even climb a flight of stairs. I get up in the middle of the night to go to the bathroom, and I'm dragging my feet. I've heard stories that, Ben, you wouldn't believe, and you're a pharmacist, you've heard these same stories, but the truth is we need to increase energy in the body, or the chi, or the production of ATP, and there's nothing like it, like ribose and CoQ10. Those two alone will increase the ATP in the body. And we've got to remember, ATP, adenosine triphosphate, the center molecule of ATP is D-ribose. People don't think about that,
So can you have a ribose deficiency?
Absolutely. Ischemia, which means that people have are getting an insufficient blood supply to the heart. Remember, silent ischemia is huge. What does that mean for the lay public? It means that your heart is burning up CoQ10, you're getting EKG changes, you're not aware of it because it's silent, but it's draining your energy over time. And that's why people with silent ischemia or angina or heart cramps or chest pain for that matter, it drags their energy, and they need D-ribose and CoQ10 because they're energy deficient. It's an energy drain, and what you really need is an energy gain for these people.
I know you know this about cancer being an energy disease. Would you say that everything that you're talking about for a cardiovascular disease, the ribose, the carnitine, the CoQ10, would also be anti-cancer nutritional supplement strategies?
Oh, absolutely. Even malaria. I mean, MIT researchers looked at this, and, one of my next books is High Vibrational Living, which I discussed.
Oh, that sounds great.
But even, it all comes down to vibration of cells. The higher the vibration of your cells, what does that mean, Ben? It means, well, you can take in nutrients easier, you can expel waste. Yeah. In other words, there's not stagnation of energy. The basement membranes or the cellular linings are, intact. They're not loose, like in leaky gut, for example. You get these loose basement membranes, and you flood your gut with toxins. So, in other words, you want strong basement membranes, and I'll tell you, targeted nutritional supports, can really do this for you.
You think supplements act like harmonic kinds of electronic stabilizing devices?
Ooh, I like that. Oh, I like that a lot.
That's what supplements are.
Oh, gee whiz.
I thought you'd like that.
Ooh, that really resonates with me. Yes, of course.
Of course it resonates with you. That's how you see the world. Everything resonates. It's all resonance, Doc. Everything is resonance.
It's resonance
and harmonics.
And it's cellular vibration.
Yeah.
And that's what targeted nutritional supplements do. I mean, whether you're taking, like resveratrol or turmeric or CoQ10, there's so many, or omega-3s, there's so many good nutrients you can take to actually, make your cellular membranes, more prolific and more functional. And that's the key word. We want our cells to be functional as opposed to dysfunctional.
Are you familiar with the work of Albert Szent-Györgyi?
Yes, of course.
So he talked about proteins in the cell being vibrational, harmonic, oscillating systems. Have you heard of this idea?
In other words, everybody knows that sugar is the enemy, because when sugar combines with proteins in the cell, we form age glycation products. And these age glycation products, they accelerate aging. That's why the number one aspect when it comes to heart disease is not cholesterol. We already hammered that one. Yeah. It's sugar. Yeah. Sugar is the cause of coronary artery disease. Because why?
Glycation.
You get an extra inexorbitant insulin response, and like we talked about before with CoQ10, insulin is the most dysfunctional entity around for endothelial cell dysfunction.
And isn't there a relationship between elevated insulin and hypercholesterolemia?
Yes, there is, but I'm not an expert in that area, unfortunately.
I've always assumed or felt like the problem with heart disease and cholesterol isn't the cholesterol, but it's the sugar, and the cholesterol is being produced in response to the elevated insulin.
Yes, and again, in these very, very overweight type 2 diabetics, or 50 or 100 pounds overweight or more, that's got to be a substantial factor going forward.
All right, real quick, tell us about the whole idea of the chakras, especially the heart chakra and heart disease.
Oh, my God. Now you're really getting it. I love this. This is like psychotherapy 101. I'm a psychotherapist. This is good stuff. Look, the heart chakra is the fourth chakra. That's really the chakra that I really like. That's why I like pets, animals, especially during this pandemic. I mean, Ben, I used to see 70-year-old people, 65-year-old people, even older people in my office who lost a loved one. They would come into the office. Their shoulders would be hunched. They'd be talking in a monotone. They were depressed. Their children were far away. They lost their spouse. Guess what would revive these people? A pet, a cat, or a dog. Pets give you unconditional love. It supports the fourth chakra. Whenever you have unconditional love, you're supporting the vibrational energy of the heart, and whenever you're doing that, you're thriving.
It's
you're living.
It's like we feel good when somebody's more vulnerable, when there's something more vulnerable than us. It allows us to caretake in a safe space. We don't have to fear. And babies and cats.
Fear is the killer. That's what's going on with COVID-19, especially with children and wearing these masks and all that other stuff. It creates suspicion. It creates fear. It's awful. So, no, fear is the enemy. There's no doubt about it.
I agree. Don't the medical, the policymakers, the medical policymakers recognize this?
I don't think so. I think a lot of these policymakers are so narrow-minded in their area of expertise that they forget about, the natural human experiment. They forget all about this.
Dr. Sinatra, I'm voting for you for Surgeon General, United States Surgeon General. I'm nominating you. Doc, it's a pleasure always talking to you. I hope you come on again soon.
All right,
Thank
we'll
you
do it
so
again.
much.
Listen, I have a new book coming out, Get Grounded, Get Well. So when it comes out in a few months, let's do it again.
We'll get you on. Get grounded, get well. Thank you so much, Dr. Sinatra. Have a good evening.
God bless.
All right, God bless you. Dr. Stephen Sinatra, awesome human being and awesome physician as well. That's it. That's all the time we have for today. On the bright side, we'll be back at you tomorrow.